Yes, thank you very much. I must say that the campaign or the polio vaccination campaign started last year, December, from 15 to 18 December 2025 in two regions where it was detected. It was detected in a sewer, Ndama sewer in Kavango East region. Around zero started off, kicked off in those two regions, and then we tried to vaccinate those two regions. Going forward, we decided also, but I must say before we proceed, before we get any further, I must make it clear that up to now there is no reported case. There is no reported case.
In the region?
The whole country. Yes. So the region is well prepared. The preparation started beginning of January in Windhoek, whereby we engaged with our stakeholders such as WHO and UNICEF just to see to it that we planned for the round one vaccination. The preparedness that I can bring on the table is that we managed to procure more than enough vaccines that we are sure of that it should be able to serve the whole country. We managed also to use the community hired vehicles for us to be able to reach to all places within 4 days. We also tried to train our community health care workers, to capacitate them, to educate them, to be able to equip them on how to do the vaccination. I remember for Zambezi Friday, we recruited members of the public in different categories just for them to strengthen the campaign, to strengthen the vaccination process. On preparedness, I want to believe that we started this morning. We visited Ngweze Primary School with NBC just to see how prepared are we. We managed, wherever I have gone or places that I have visited, I didn't meet longer queues than expected. That's a symbol that as kids are coming, they are being served in a shortest period of time, and then they are being let go. It's like when you get to our mobile teams, to our fixed points, the service is such quick that we don't experience longer queues. And then all this boils on the issue of preparedness for us to be able to render the service in a reasonable time. The fixed points, all our facilities, clinics that we know, we can talk about. In town here, all the clinics, Ngweze Clinic, Mafuta Clinic. If it goes this line, we can speak of Masokotwani, Kanono, Linyante, Malengalenga. When we go this side, Kayenda, Sibinda, Sachona, Sesheke. If we talk of this side, we talk of Bokalo, Ngoma. All the fixed points, or at facilities, there are fixed points to be able to give that service. When we talk about mobile teams, these are teams that are going door to door. They would enter into a village, they do go door to door to be able to immunize, to vaccinate kids, and then they are taking records of that are required by the ministry. The slogan is that no child should be left behind. We usually used to say, even those places being designated as hard to reach areas, there are people living there. And then these people, we cannot say they are stationary. These people, they do make their tents here and there. How are they surviving? You find that for them to be able to get this and that service, they have to travel. The issue is wherever there is a human being, the aim is that we have to reach there. I drove up to Itomba. This morning we deployed a car which went to Impalela via Kasika. We went even to Nakavolelwa also. These are places that has been designated as hard to reach, especially the seasons of the year due to floodplains. But I must say that few places that I have visited, I have seen that they are still accessible. Where accessibility is a challenge, we will try to use other means, like we can get a boat. We can speak of Opuo also. In Opuo, whereby it's already known that there are places which are difficult to reach. We have secured a helicopter there that will save that place to be able to reach everywhere. We don't want to have it as an excuse that they are hard pressed. We just want to plan about those places and get there, because now there is a need that we get there. So the issue is we have to sit around the table and say, how do we get there? which best mode of transport can get. If it needs a canoe, we'll send a person who can paddle and get to that place. If it needs a boat, we'll do the same. If it needs swimming, if somebody can swim to that place, we should be able to get one to get there. But there is no excuses that there are hard areas to reach. The idea is to reach the all corners of Namibia for the sake of a Namibian child. Sure. The vaccination campaign started today, the 26th of January 2026, and it will end 29 January 2026. The second round, it will start on the 24th of February 2026, and then it will end on the 27th of February 2026, whereas the one which ended already in December started on the 15th and then ended on the 18th of December. However, we will still come back again to our people through platforms such as this when we move to the next round. Even when we are in the current round now, which is round 1, we will keep them updated on the proceedings, how far we are going and so forth. Even those who might be in need of information, they can still contact us, and then we'll be glad to give them the information. We do not want our people to lack because of non-knowledge.
Well, thank you very much, Mr. Kamaya, for sharing such important information. I'm sure the residents of the region have heard, and they are going to make sure that their children are vaccinated in order for them to be prevented from polio. Thank you very much.
It's a pleasure. We shall talk again.